It was an interesting time, as I say, and like I said, it's the small things that become big achievements in your life.
My name's Jeremy Latham. I'm an orthopaedic surgeon specialising in hip surgery. I practice at the Nuffield Health Wessex Hospital in Southampton. I've been a surgeon for over 20 years. Most patients come to the hospital at about 7:30 in the morning. The nurses greet them at the hospital, take them up to their room, and then they see me. I mark the correct side and go through the consent form. They're seen by my anaesthetist, who goes through what the anaesthetic process is going to be, and then the patients are taken to theatre. I see them again in the anaesthetic room and make sure we're doing the correct side. And then the patients go to theatre, we do the surgery, and they come into the recovery room for about an hour or so, and then back to their own room. The nurses then take care of them, give them pain relief, and often we get them up on the day of surgery. So things move along fairly promptly on the day of surgery.
The day of the procedure, because I'd met the surgeon several times before the day, so I was very, very comfortable with him. When I arrived, the staff, the nurses, were very, very friendly, and if anybody's nervous, they needn't be, because you're immediately put at your ease. So it was very easy and very smooth, and it was fine.
So the morning of the procedure, I got up very early to make sure I could have some coffee and have some food before surgery. Then me and my husband, we headed to Nuffield Health Cambridge Hospital, where I was shown to my room, which was a lovely room. And the sister came to visit me, and we had a good chat. And she gave me my gown and showed me around the room and let me know that everything was there for me. Following that, my anaesthetist came to visit me, Dr. Maroof, and again we had a conversation where he asked if I had any concerns or fears, and he helped allay those fears, and he was just very calm and reassuring. When he left, then I just spent the next half hour with my husband, just sort of getting ready and just actually looking forward to it, if you can believe that.
So initially, in recovery, the patients will be greeted by the nurse looking after them and make sure that they're comfortable. They do a set of observations. And then in the few days after the operation, they initially have some blood tests for the morning after surgery, and also an X-ray. Also meet the physiotherapist to get them back up on their feet, make sure they can do things like stairs, and that they're safe on their crutches. And then there's basically myself and the surgeon, the anaesthetist, the nursing staff, the physios make sure and assess the patient in terms of their fitness for discharge, which tends to be 2 to 3 days after surgery.
Just after the procedure, the first day you're obviously in your room. You don't get out of bed at all. The nurses are constantly there, coming in and out, but the following day after that, you are always in attendance. The nurses are there, walking up and down the corridor on crutches, and again, if you felt any pain or any discomfort, they were there to guide you back to the room, which I didn't. I mean, it was absolutely fine.
Immediately after the operation, I think I was in pain, but I had a lovely supply of drugs to help with the pain. The next day, I got up, I got dressed, I felt like a human, although I had a new hip, which wasn't a human hip, but it was still good. I had the physio come to visit me, and we did some exercises, and my body did feel like it had major surgery. There's no denying there was a bit of pain, but it was a positive pain. It was the pain of knowing that this was the beginning of things getting better.